Melasma is one sort of hyperpigmentary disorder. Okay, and let's talk about its uh, demography. It is very commonly found in females, especially in 20 to 30 years of age. And people often they come up with a history that this happens after pregnancy or whenever you have a major hormonal changes, and maybe during when you're approaching menopause or post-menopause. So this suggests one very important aspect, that how it looks like. So melasma is a very well-defined pigmentary problem. It is mainly of three types. Number one is centrofacial, number second is malar, and number three is mandibular. Now centrofacial, as the name implicates, in the forehead, around your nose, in the upper lip. And malar is basically around your cheekbones. And last is the mandibular, which may extend up to your neck and chest also. Now, what are its pathogens? Why this happens? It is not a very normal pigmentation because there are various theories. The most important is that it is definitely linked to very important two aspects. Estrogen, that is your female reproductive hormone. That is why it is linked to all people. They do get melasma during pregnancy or like I told you, after whenever you have hormonal changes, when patients are on oral contraceptive pills or menopause, post-menopausal, then sunlight is a very important aspect. Genetics do also play important role, but if you are a chronic exposure to sun, you may develop this very early. When we talk about sunlight, first of all, when we were told about sunscreen, we used to hear many things like there are many filters like UVA filter, UVB filter. But nowadays, the latest studies, they have come up with an option. They have come up with one more criteria that you should also take protection against visible light. So earlier, it was a broad spectrum sunscreen, which was UVA, UVB. And now they also suggest that it should also cover or should also filter out the visible light, because that also significantly impacts the pigmented properties. There are many hyperpigmentary disorders. Melasma is a different, because melasma, number one, it has a different pathogenesis. Some says vascularity. There is increased vascularity over that local area, also result in melasma. Some says it is hormonal influence, like I've already told, it is because of estrogen influence. And sunlight is basically a common factor in all the situations. Secondly, melasma has a very typical presentation, and it is always symmetrically associated. Then it is very well defined, and to start, it's a very brown pigmentation, typical brown pigmentation that gets darker on exposure to sun or due to post-inflammatory hyperpigmentation to various depigmenting creams that we are using. And also, it is different from other hyperpigmentary disorder in a way that it is a very resistant and it relapses, very resistant to treatment, and there are very high chances of relapse. So that way also it becomes different from other pigmentary disorder. Then, as I've already discussed, that it is female predominant in a very specific age group, 20 to 30. And yes, of course, sunlight does matter. Most commonly, these are the only factors that makes it different from other hyperpigmentary disorder. And it has typical areas of presentation. Like I told you, it is centrofacial, it is malar, it is mandibular. Sometimes it may extend to your chest, your sternum areas also. The pattern of presentation, the etiology, the hormonal driven, and response to treatment. It makes them different from other hyperpigmentary disorders. For any pigmentary disorder that comes to us, and which includes melasma also, is a sun protection. Okay, so nowadays they have come up with sunscreen, like I told, broad spectrum with all the three filters, which includes tinted. Now you must have listened to many brands. It's a tinted. Now what exactly a tint is? Now tint is a ferric oxide that is adding up new dimensions to the sunscreen, and that also has a very good effect as per with respect to sun protection. First and foremost, for any pigmentary disorder, including melasma, sun protection is must. And which implies use of sunscreens. Every sunscreen should be applied after every 3 hours. It should be reapplied if you sweat, if you have taken bath or you get wet in the rain. You have to reapply that. But there's a particular quantity of sunscreen that should be applied, like it should be a point shape when you apply on your face. Number one. Then physical sun protection. So whenever you go out, you have to take like cover your face, wear like very broad brim hats, sunglasses, and even just full sleeves. You should cover your arms and all exposed areas. Number one. Then coming to the medical aspect, there are many depigmenting creams which is available. Now, quote unquote, it should be whenever you should use, you should always read the instructions that there's certain cream which should not be used if you're breastfeeding or you're pregnant. Now, as per interventions, we have depigmenting procedures like you have peels. Then coming up to treatments, peels, as I said, laser. There are two lasers, like a fractional CO2 laser, and we have Q-switch NDR laser. So again, various settings are required, which has like given in certain durations, and they also help to reduce melasma. Coming up next is microneedling, RF technology. What is microneedling? Microneedling is basically a drug delivery system. That is, you are delivering drug like tranexamic acid or vitamin C through microneedling or direct injection into the dermis of the skin. Coming up, very important that we have radio frequency. So these are the medical treatment which is available.